then, of course, in the last, I think it was the last week, we found out that he was breech. So, having been to Stepping Hill, we had a scan there and they confirmed that. But it was quite a hard breech to detect, actually, because the consultants weren't so sure. But then, yeah, he was. And so we booked in for C-section.
There's obviously two different types of caesarean. There's an elective, which is a planned caesarean section, which is obviously a discussion between the obstetrician and the patient. And the obstetrician may well recommend a planned caesarean. Or there's an emergency caesarean, which is when a situation obviously crops up during labour or unplanned time. And these are decisions that are made between the obstetricians and the patients.
And I didn't quite know what to expect, how bad it would be. And I must have gone to the toilet about 6 times. Every toilet there was, on the way down to the theatre I'd stopped in it. And my husband was sweating. So there was no question, we were really nervous, just going down. But then once we got there, the anaesthetist had met us prior to that, to going down. He'd met us that morning and talked us through everything. And he was brilliant. I found him really trustworthy, and that there was going to be no hidden surprises.
We have a theatre on delivery suite, and there's a resident anaesthetist 24 hours a day. So any decision of a caesarean section being needed means that we can be there in the rooms into theatre as soon as possible and anaesthetised promptly to enable a quick delivery. And
so when I went down, I met him, and just really reassuring. And he did the local anaesthetic, and there was another sidekick to him who was really helpful as well. And they were two good fun guys, and they sort of took my mind off it. You know, we were having a bit of a laugh as they were injecting me, and then it was all okay.
Obviously, if the patient needs a caesarean section, then we've got to give them some kind of anaesthetic. And generally speaking, the choice is between staying awake with a spinal anaesthetic or an epidural, or going to sleep under a general anaesthetic.
But they're like slightly more painful, and roughly every 5 minutes, but there's like the odd one in between that's like at a random time, and it's not a proper one, if you know what I mean. And like the ones after 5 minutes are way more painful than the ones after like 1 or 2 minutes. So they're like often but not regular at all. So I'm just gonna like Noah's been awake since like 2 or something silly as well, and so she came into our bed for a bit, and she's like super cuddly. So yeah, but now it's getting like, some of them are getting too painful to be cuddling a child at the same time. So I'm like, Luke, can you try and get her back to sleep? And I've come down and got her a boppy and everything, and she's now back to sleep in our bed with Luke, and so he's asleep as well, as far as I can tell. And I'm just gonna sit on my birth ball and kill some people on PlayStation for a little bit, and then wait till I'm in agony, basically. I was going to ring my mum about 4:30, but I don't think they're a big enough deal just yet. So I think I'm going to wait till 5 if I can now. So that's the plan anyway. So I thought I'd take a video just in case it does turn into something. It could all die out yet.
How are you feeling then?
I'll get it.
That could be easy.
Hold up. Excuse me. Would you like a beaker of tea? It's a flamingo. Remember, you said it before. You said mingo. Flamingo. Hello. Can you say that? Alright, how are you? Who's this? No one. Who's at the door?
Your contraction times.
I'm making a cup. You want one?
Yeah, I mean, lately they're not making sense.
Yeah.
Noah. It's Georgie.
So a special little helper.
Georgie.
And her mum.
How are you doing? Noah, you going to show Georgie the game?
This precise moment.
Fine, at this precise moment.
No, okay.
I'm not having one.
Yeah.
But I'm getting worried that they're going to stop.
Well, they stopped during the day, and then they've come
Yeah,
back.
they started at like
tortoise.
2. They were getting closer and stronger until like
You're fine, you're fine.
11. Like at one point they were like 3 minutes apart and really quite strong, and then at about 11 Just all ended for like 2 hours. Was it 2 hours?
Something like that, yeah. He had a sleep during the day.
Do you want a bit?
So what's the time now? 5:15 on the 24th of October. 4 days overdue.
Oh, yeah.
Is that what it is?
No, look at the hats that Georgie has. Come on.
News is that bump is still there and we're having contractions, but they had stopped earlier, so it's good.
How far apart are they now?
Like 6 minutes.
They stopped for like an hour and a half and come back stronger, but like longer in between. So me, you, Lisa, and Georgie.
I have a dream. What, they're going?
Oh, careful!
We will be in a little bit,
Yeah.
but they're not. I don't know.
Are they painful? They look like they are. You excited? You videoing?
No, I'm scared they're gonna all end up. All fizzle out.
I don't think it will. Trust me. Try to get to sleep again, because every time you do that, she pops back up again.
Mother dearest.
What are the contractions doing at the moment?
They stopped at like 11.
They're averaging about a minute, about 5 minutes apart, but the last few we had a 6 minute, 5, 3, 2, 2, 1.
Blast off!
And I would imagine any time soon, really. So, you know, when you stop holding this camera straight,
And it is.
probably means.
Ooh, it's wobbly. It's 7 o'clock on the 24th of October.
Bella has just text wanted to know if you're in labour, I think.
Why?
I don't know. I just saw it flash up on the top. I didn't see all the message, just something about you, labour.
Okay, and that's the start of one. Ow.
Okay.
I cannot see you at all.
I am here.
Are you excited?
Yeah, I'm like nervous, excited.
Nervous, excited.
Yeah.
You excited?
Oh yeah. Can't wait to see her.
But we're just gonna. We're nearly at the hospital now anyway, and we're gonna go and see what's going on, see if this is doing anything at all to the cervix.
Well. So.
You're right.
Off we go.
We are, what?
7 centimetres already.
Yeah, 7 centimetres.
Walks have gone. That's the first checkup.
And it's what? That's the time.
First date, 20 to 1.
7 centimetres.
And that's the first bit of pain relief you've had. So well done you. Okay.
Sorry.
Good girl. That's it. Okay, keep going. They're lasting quite long now, aren't they? Is the pain still in your back?
Couldn't believe it when they said 7 centimetres.
No, that's really good. It's everywhere now. You say if you need something, okay? If that's making your mouth dry and you need more.
The whole time, okay. Alright then. You're doing really well. Good girl.
Yeah, you're getting there. You're nearly there. I can see you.
Babe, I can see her as well.
Their head's going to be out soon, so
Try and keep your legs open. Breathe.
I know it's easier said than done, but try and listen to them, okay?
Focus on your breathing, she's nearly there, we can see her.
Just deep breaths, keep breathing.
Hold her up, Luke, if you can.
That's it, well done, you're doing really well. Your head's coming out nice.
As I said, one of the probably quietest labours you're going to deal with.
She's doing really well. We're not far away now, keep going.
Don't know where she got this head of hair from though.
Beautiful head of hair.
She's nearly there, keep going. I know, keep going, you're doing really well.
See, Noah was
We
born
can
with
see your
blonde
head
hair.
now.
So, Noah was born with blonde hair. Listen.
She's coming.
Listen.
She's coming. Is that her head out?
Yeah, that's her head out.
Lovely, well
You're
done.
doing really well.
Is the cord clear?
Good girl.
That's it.
Is his arm meant to be down there? Is it alright there? Good girl, babe. Babe, almost half out.
Emma, look, open your eyes.
Emma, do you want to have a look?
She's
Get her
coming.
in a minute, Emma.
Emma, you're going to have to get her in a minute.
You got it? You got it? You got it?
Here she is.
In a midwife-led unit or birth centre or at home, because they have thought about birth very carefully and they really think that they'd like to try for a normal birth. I think they understand that midwives are experts in normal birth and are absolutely passionate about birth. This is where we actually let you labour. It's nice and homely and comfortable.
Oh, it's like a sitting room.
Yeah, it is, and birthing balls to lean over on. It's also a very intimate experience because the women get to know their midwives during their antenatal period and become very confident in the support that they're going to get in that environment.
And after I'd had her and held her for a while and got rid of the placenta, then my husband cut the cord. The midwives came to check up on us a couple more times in the day, but that was really quite nice because they felt like family and they just came in the bedroom and, you know, it was just a really nice atmosphere.
Some women won't be suitable for
care of a midwife, and all women need a midwife, and midwifery care for delivery can take place at home or in a midwifery unit if there is a freestanding one, or in hospital. And I would like to think that we can provide just the most basic but full midwifery care in the hospital unit, but should there be a problem, there are doctors around to help to intervene if necessary. There are some people who we would recommend, because of complications, have a baby in hospital. There are other people who would choose to have it. The underlying benefit is that if there were to be some reason that they would be better off with help from a doctor, then they're in the right place to get intervention if necessary.
I've got a blood condition that causes my blood to be slightly sticky, which means that sometimes it can clot. So particularly in pregnancy, that's not a good thing. So for me, I felt that I needed to be at a hospital.
So we can hide any high-tech equipment if it's not needed.
With a hospital birth, you're not at home, but you can still make it feel home. You can take your own things in, and taking my music in helped. The fact that we had that ensuite room and we had an area that we could use and we didn't need to go outside the room, it was our space, was nice.
We're here to make everything as normal and natural and wonderful as it possibly can be, and only to intervene if really necessary.
It was the labour that I wanted, because I did want a labour where I had minimum pain relief, and in actual fact I managed to have a TENS machine. I think I had a couple of puffs on gas and air while I was examined, and that was it. So I didn't really have much pain relief, but actually that was good for me.
There are times that we know we need to assist the delivery, and that means using either forceps or a ventouse. It's a suction equipment for delivering a baby, and it's commonly used for assisted deliveries now. People can choose to have an epidural if they want to, if that's what they'd like for pain relief, or sometimes we will recommend it. But if you have an epidural, they have to have a drip in their arm just to have some fluid, and then they have the epidural, which involves putting some local anaesthetic in the back and then putting a needle in. We try very hard not to give general anaesthetics to people. We try hard to use what's called regional anaesthesia, which is either an epidural or a spinal.
I've got diabetes, so women with diabetes have bigger babies. So I had my first baby, she was induced, but then I ended up having an emergency caesarean section. And then my second baby, we decided with the advice from the consultant and midwives to have an elective caesarean.
The vast majority of elective and emergency caesarean sections are done under spinal anaesthetic, so the woman's awake. It's an enormous advantage that if she's awake, she's involved in the experience and her partner can be there.
You can kind of like feel something pressing on your tummy gently, but it's not painful, and you know, it's quite comfortable really, you just can't feel anything. I couldn't drive or hoover or carry heavy things for a good 4 to 6 weeks, and then after that, you know, I was completely recovered. I didn't have any problems.
Often, and perhaps most often with a vaginal delivery, there's enough space and the tissues all stretch, so there's no damage and no stitches necessary.
So it would be sensible for them to go to a consultant unit. Tips for having a normal birth is to really get to know your midwife, talk to her about your options for birth, find out strategies for coping with normal birth and having confidence in your body to give birth to your baby. And a really important part of progressing to a normal birth is to understand the latent phase of labour, that early part of labour where we really encourage you to stay at home and sleep, you can eat, you can get in the bath and feel relaxed in your own surroundings.
It's great to be able to just sort of do what you want when you're in labour and just to feel comfortable enough to do it. Just sort of walking around and going to make some food in the kitchen or just do what you need to do really.
The pain relief that we have available to women who might decide to have a baby in a birthing centre or at home is we use aromatherapy, massage. A lot of women, if they're going to have their babies at home, will hire a pool. So this is our birthing pool, probably used by about at least 80% of our women. They absolutely love it.
Yes.
The water's very, very supportive. We do have gas and air or Entonox, which is helpful for the last stages. We do have injections that can help with pain, but we actually very rarely use them. So this is the ward. We've actually got 6 beds in here. Yesterday it was much fuller. We had 3 or 4 mums in here, but they've gone home, so we've got just the one today. It's really important that you discuss the options for your birth and your setting of your birth with your midwife or your doctor, because these will make you feel much more relaxed and confident in that process. Women make choices for their birth, but sometimes
our families will help us out, but both of our families live about an hour away. It would be nice to have something to schedule around, you know, to know like, okay, we have this tentative date where we can have people in place where we need them to help with the girls.
The Yeagers are part of a trend, scheduling their delivery, and Jessica hopes it's by C-section.
Right now, the elective deliveries are standing at about 29% of the births in this country, and that's way too high. Back in 1990, they were at 9%.
It's not surprising. Does it make sense? Does it make medical sense? No.
Doctors collectively share worries about any elective delivery before 39 weeks, induction or C-section, with no medical reason for it. In fact, doctors say
it is just not the recommended practice.
But it still happens.
I think our culture does impact this because we're all checking our BlackBerries. We're all trying to, get as much done as we can in a short period of time. And I think this is sort of a result of that.
Barbara Rudolph works for the Leapfrog Group, a watchdog organization keeping hospitals nationwide in check. She's run the numbers from thousands of hospitals across the U.S.
What we've seen is that there are hospitals that have 0 elective deliveries, and then there are hospitals that have 40–50% of their deliveries being elective deliveries.
Rudolph says Madison hospitals are resisting the trend, but across the country...
Who is a free birther and birthing expert, Claire Byam-Cook, and welcome both ladies. And our little lad here as well, he's, what's he called? He's Rory. Rory, yeah. Yes. So this was really an experience for you that started when you were about 22, because you're an ex-nurse and you gave birth to you've got 3 children.
Yes.
And he's the 3rd. And the first time round, the experience wasn't what you wanted, wasn't what you expected.
No, I mean, on paper, it was very straightforward. I went into hospital, had a 5-hour labour, and was discharged 6 hours later. But for me, it was absolutely everything I didn't want. Even though I gave birth with no pain relief, they insisted on monitoring me. The midwife was very focused on her monitors and on, the rule book.
Yes.
What I was
a lot of people would say
to do.
maybe that wasn't such a bad thing to be monitoring, looking at the monitors and to be making sure that what was being said on those monitors wasn't going to cause a problem for you or for the baby.
Absolutely, but birth does not need to be over-medicalised. It's for the majority of women, it is a natural event. It's something that your body does, that women's bodies have been doing for centuries, and that doesn't need any help. I mean, I'm not denying that for a percentage of women, medical intervention is necessary and welcome. But
so first time round, too medical.
It is a larger needle, but it does not stay in. We use this larger needle to identify where the epidural space is. At this point, as we press down on it, you will feel, the pressure of the needle, but it shouldn't be painful, but you'll feel a gritty sensation. That is just us going through the layers to get to the epidural space. Once we're at the epidural space, we will inject local anesthetic to get you comfortable. The local anesthetic is just put in with a syringe. It will feel a little crampy. It's hard to explain that, but that's what women say. They feel a little cramp in their back. That's it's good and bad. We don't want you to hurt, but it also lets us know it's getting placed in the right place. So the local anesthetic will be placed there. Once it's administered, what we'll do is insert a very small and very flexible, very soft piece of plastic. Once we find the epidural space using the needle, we remove it. So once the local is administered and the plastic catheter is placed, we will just tape the rest of the catheter to your back. It'll come up over your shoulder, and we'll hook it up to a machine that will continue to give you medicine throughout the rest of the delivery. Once you've delivered your baby, we just untape the tape and it slides right out. People are always concerned about risks with epidurals, and although there are certainly some serious complications that can happen, most of the time it goes very well without any problems. It usually will not cause any more back pain than women that don't get epidurals, and we feel that it does not cause any problems to the baby, and it's very safe for the mother as well. You might notice that you felt like you've had a shot in the back. No different than if you had a...
Answered any questions that we had. The food was actually wonderful. We had good omelets, good breakfasts.
Parents to have another member of the family join, of a child. And we are here at the Spartan Stores Family Childbirth Center at Metro Health Hospital. I'm standing with Dr. Stephen Lown of Michigan OBGYN. This is a beautiful facility you have.
Oh, thank you, Rachel. It's great you could come here today and see our facility.
Tell us a little bit about it.
Well, our facility's new. We've been here for 3 years now, and it's the newest, most up-to-date childbirth center that there is in the Grand Rapids area.
State-of-the-art, very personal, very inviting. It's a really important time when a family is about to have a child to come somewhere that they feel really comfortable.
Sure.
What exactly will they see when a family comes here to have a baby?
Absolutely. Well, what they can experience first is what we call the triage area, which is the area where we bring patients to assess whether they're really in labor or not. Once they're determined whether they're in labor, then it's like I said, they get the golden ticket, and then we admit them into the labor and delivery area, which is where we're at right now.
Yeah, and looking around, you've got a lot of wonderful accommodations here, probably the nicest I've seen.
No, it's just absolutely beautiful. It is.
It is. So you've got your TVs, you've got bright big windows, and this is a large room too.
Yes, and all our rooms are the same. All our labor and delivery rooms are centered on the outside here, so which again, compared to what the state of Michigan is with an overall decrease in births statewide, I think we're doing very well.
Wonderful to hear. We're here now with one of the RNs.
Anesthetic for dental work. We just deposit the local anesthetic near the nerves that innervate the uterus as well as the lower part of the body, so that when women have contractions and deliver the baby, they have good pain control and are able to enjoy the labor process better. As you can see, this is a little complicated, but this is a cross section, and this is the woman's back. The needle gets inserted close to where the nerve roots are in the spine, but not into the spine. And we deposit the local anesthetic so that it will affect the nerve roots and block the transmission of pain. I will show on our lovely model here exactly how the epidural will get placed. Of course, when you do have it placed yourself, the anesthesiologist will have gloves and a gown and a mask, but for demonstrations I'll just use my hands without a mask. The most important thing when getting an epidural is to be positioned correctly, and she's doing a great job here. You kind of have to have bad posture. We ask the women to kind of slump over with their shoulders slumped, as well as their back pressed out. We say either like a mad cat or like a piece of boiled shrimp. And that allows us to place the epidural needle in the correct spot very easily. And then at some point they'll use their thumb to make a little indentation. That allows us to know exactly where to go. At this point, we'll have everything ready to go. So we'll take our cleaning solution, which is just usually a betadine alcohol solution. Use a little sponge stick like this to clean off real good. Get it nice and clean. The next point will be
what it is without looking at it.
Paper clip.
Okay. And now the other hand.
Key. Oh,
okay.
sorry.
That's all right. I didn't give you very clear instructions, did I? Okay, let's try this again.
Okay. Penny.
Okay. Excellent. All right. Well, that all looks very nice here. So let's take a look at your back. And the first thing I want to do is I'm just going to look at you, okay? And I want to look at your skin, particularly since you are so lovely and blonde and blue-eyed. Make sure there's no skin lesions there. And I already looked at the skin on your arms. And now would you please take a nice big breath in, okay, and let it out. Excellent. Okay. And I'm just going to tap on.
I wash mine and my nails.
Oh, thanks so much.
What job do you think?
Okay.
Okay, when you start. Take some pictures. I need to go.
Guys, it's one. Hi, mommy. Okay.
Doing great. Doing great. Great.
Yes.
Yes, squeeze my calves.
Squeeze my calves with it. Calves over.
Yes. Deep breath. Oh, I see that. It's nice.
Doing great.
Okay. Okay.
Oh! Oh my gosh!
So let's come and nap. You can ring.
That's about
Oh, thank you, John. Thank you, God. Thank you, thank you, thank you, thank you.
She does. All babies have eyes.
Oh, but I really do. So cute. Oh my gosh. I said it's my dresser earlier today. Oh, look at her. She knows her mommy. Look at that. Oh, that's mommy. That's mommy.
What happened at the time was
Well, the birth's not really over until the placenta is birthed, and we kind of got caught up in everything and kind of forgot about that a little bit.
We were just so excited that Indigo had appeared, and I wanted to show my mom, and in that excitement maybe we kind of lost the energy of giving birth. And so definitely if I was giving birth, one thing I would most certainly do is not contact anybody or even have anybody else into the room until you'd birthed the placenta. So, but my mum was really worried because the placenta was so short, and I was holding Indigo the whole time.
The cord was so short.
What did I say?
The placenta.
Okay, sorry, the cord was so short, and so she kept saying, "Oh, Victoria, just cut the cord, just cut the cord." But I was holding out. No, we're going to do this lotus birth. So we waited. Was it 12 hours?
12 hours.
We waited 12 hours, maybe just over 12 hours. And in the end, I think it was just causing my mum too much stress, and I thought, okay, we'll cut it. And the cord, you know, I thought at least he'd had 12 hours, and I was kind of happy that he'd had that.
So I tied a little bit of cord.
A little bit of rope.
Just cord.
Yeah,
a bit of cord around each side of the umbilical cord, and then just cut it. And by then it was when a baby's first born, they cut the umbilical cord. It's still like really you know, squidgy, but by this stage, it like all the you know, nutrients, all the fluids, and everything had gone through, and so the cord was like just like a bit of rubber by this stage, without all the fluids and everything in it. So it was completely different to the way the cord is normally cut, and that's one of the reasons why we wanted to keep the cord attached, because the baby's still receiving so much nutrients, and there's what the T cells and which really boosts the baby's immune system. And when that cord is cut prematurely, the baby doesn't get all that. So that's one of the reasons why we want to keep the cord attached and do the lotus birth. But 12 hours still, by that stage, there didn't seem to be much left or anything left in there. It had all kind of gone through in those 12 hours, so it seemed like, okay, it's okay to do that right now.
Yeah.
So yeah, cut the cord, and because it was cut